Well, many of us have marvelled over magazine pictures of shrinking celebrity mums who just weeks after giving birth are often pictured flaunting tiny post-baby bodies. It does nothing for normal women who can be left feeling inadequate and desperate to shed excess pregnancy kilos the quickest way possible. In America, 365,000 women opted for a mummy makeover in the past year. And now an increasing amount of Australian mothers are inquiring about post-pregnancy surgery. It's often seen as an easy fix for losing baby weight. However, in some cases, surgery can be dangerous for women who've just given birth, especially if they plan on having more children in the future. Recently, I spoke with Australian cosmetic plastic surgeon, Dr. Ben Norris. Dr. Norris, welcome. We're talking about the suggested increase in women opting for post-baby surgery. I have to say it does strike me that it's possibly not that surprising considering the number of celebrity magazine photos that we see of these celebrities who've just had birth and have got amazing results with losing all their weight. Is that an issue, do you think?
Well, I don't think it's surprising at all. You know, those magazines are very well read and they're very popular. On a positive note, I think, though, that most of the women, certainly that I see in my practice, I think realise that what they're seeing is relatively unrealistic and not totally relevant to their own situation.
Do you think that's the case, though, considering that it's certainly put up there as the ideal? All the headlines we see say amazing weight loss, look how wonderful she looks, it's only been, 3.5 weeks since she had the baby. But what they don't point out is that these women obviously have access to trainers, to chefs, to nannies. They've got all the time in the world, all the money in the world. It is unrealistic for everybody else, isn't it?
I think it is unrealistic, and I think on a positive note we should applaud most Australian women who are bringing up a newborn. The rigours that go with that, the sleeplessness that goes with that, they're managing a household and they're managing a partner or husband without all of those benefits, without the luxuries of round-the-clock nannies, personal trainers, full-time chefs. What I would say, though, is that many of the women that I see, they take that and they say, well, I've done that. I've run a household. I'm bringing up a child. I've managed my husband or partner. Now I'm going to do something for myself, and that's how they see it. So
you don't necessarily think it's a bad thing. Obviously, you're in the business. I suppose is the concern women who are opting for surgery after having a baby as a quick fix without having put some time into trying to lose the weight through exercise, through healthy eating?
Well, I can only speak from my own practice, but the vast majority of women that I see in that situation have in fact made some effort to lose the weight that they gain during pregnancy through sensible exercise, supervised exercise and some sort of dietary regime. Sure, many of them will have actually come and seen me in consultation perhaps within weeks or months of having had the baby, but will generally choose not to undergo the surgery until after the sort of recommended 1 year, 18-month mark.
Yeah, sure. Okay, so let me ask you about some statistics. Some 365,000 women opted for a mummy makeover last year in the UK. Is there any indication of women in Australia and how popular it's becoming?
Well, I can certainly speak from my own practice. I don't think there's any raw data throughout Australia to suggest how many mothers are undergoing these sorts of procedures, but certainly almost 1/3 of all the women that I see are recent or young mothers seeking rejuvenation.
And that's increased? Have you noticed an increase over the last year or so?
Very certainly, because the term yummy mummy, which is a relatively new term, is bandied about as common lingo, and so it's in a woman's mind probably well before she actually even gives birth to her baby, that there are things that she can do after having had her baby to rejuvenate herself.
What sort of things are we talking about? What procedures and what surgery?
By far and large, the most common two procedures that women seek consultation with me for are abdominal rejuvenation or a tummy tuck and breast rejuvenation. So that's primarily breast lifting, especially after the influence of breastfeeding, and breast enlargement.
It's a fairly drastic option though, isn't it? We're talking about serious surgeries.
Well, it is serious surgery, and again, I think we should applaud Australian women who have usually done their homework well before they come and see me, either through media outlets or through internet and magazines. I think they do come very well informed. They realise that surgery, it's not the same as going down and having your teeth whitened in your lunch hour. They realise that there's an investment in time before thinking about the procedure, investment in actually having the procedure, and then certainly in a recovery phase.
The other thing I wonder with this obsession with being skinny very quickly after having a baby is whether some people exercise frantically or even reduce their intake while they're pregnant so as to not put on the weight. Do you think that's an issue?
Well, you know, I was reading one of the glossy magazines last night and saw the Nicole Richies and the Katie Holmes and people like that very clearly have restricted their diet during their pregnancy state. They've exercised to what we would call extremes, and then they're doing that again within a short period of time of giving birth. Most Australian women, I believe, are not doing that. With regard to exercise, there's no evidence that undertaking low impact supervised exercise does you any harm, up until the point where the hormonal influences on pelvic and lower limb ligaments are lengthening, in which case it's probably not a good idea to continue. But certainly undergoing high impact exercise during pregnancy, well, that's not something that I would recommend.
You often hear that it takes about 9 months to put the weight on. It should take 9 months to get the weight off. You laugh at that, but is there a period in how long should it take a woman to lose the weight?
Well, you know,
I suppose it depends how much she's put on as well.
Well, that's true, but you know, my own wife is a relatively young mother, and I know for a fact that it took her a good year to get her
I can attest
pregnancy
to that
weight
too,
off.
don't worry.
And that's in both, you know, 2 children. It took, you know, a year each, and I think that's a more realistic option. I don't think there should be pressure on women, especially Australian women, to appear as svelte as you did prior to your pregnancy. You should enjoy the first year of life of your newborn and take your time. And I find in my practice most women take a year to lose it.
Okay, so if women have the money and really want to do it as far as surgery and procedures, you would obviously support that as their right to do that.
I do support it, but remembering also it is surgery and it must be taken in context. Probably 1/3 of all of the women that I see seeking this sort of surgery, I say, this is not for you. And the reasons for that may include psychological or feeling that it's going to improve relationship issues, but primarily because they're just not quite ready for the surgery. Also, I believe that if you get yourself down to close to your pre-pregnancy weight or your ideal weight, the surgical result will be better and your feelings about the outcome will be superior.
Right. Dr. Ben Norris, thank you.
You're welcome. Thank you.